Hi, my name is Shelby Kite, and I have done my presentation over sudden infant death syndrome, or SIDS. Sudden infant death syndrome is when an infant who is 1 year of age or younger and who seems relatively healthy stops breathing or suffocates in their sleep and dies during the night for no apparent reason. This syndrome can also be called crib death. SIDS is hard for researchers because there are no real signs leading up to this syndrome, and so there are very many questions and very little answers to SIDS. The causes are not completely known, but there are some speculations as to what causes SIDS. The first cause is there's a part of the brain that controls an infant's breathing and also controls their ability to wake themselves up when they need to. And a lot of the time, especially in low birth weight or premature babies, this part of the brain doesn't function correctly and can cause SIDS. Another cause would be if a child has had or has a respiratory infection, such as a cold. This can cause them to have trouble breathing. An infant that sleeps on their stomach or side can have more difficulty breathing. My causes continued. Having your infant sleep with you can also be bad because you could roll over on top of them and not know it, or the blankets that you use can cover up their face and can ultimately block their airway and suffocate them, causing SIDS. An infant that sleeps on loose bedding or that has blankets that can cover up their face, this can also be bad because it can, like in the above one, can block the child's airway. Overheating from too many blankets or from the infant's clothing can cause SIDS. If the child gets too hot during the night, they can have trouble breathing. And lastly, an infant that is around someone who smokes will be at a higher risk due to their inhalation of the smoke than somebody who is not around smoking. The risk factors are pretty unknown, and they're not really sure as to why some of these are risk factors. But the first risk factor are males are at a higher risk than females. Also, infants are more likely to die of SIDS in the second and third months of their life than any other months leading up to the first year. The race of the baby has shown to matter. African American, American Indian, and Eskimo babies are all at a higher risk. If the family has a history of SIDS, such as if a sibling has died before them of SIDS, then they are at a higher risk factor. If the infant's mother is under the age of 20, or if the mother had bad prenatal care, then this also puts a child at a higher risk for SIDS. SIDS can ultimately happen to any child, so it is always a good idea to take the precautions to prevent SIDS. Some of the ways that you can prevent it would be to place the child on their back. Researchers have now said that you should never place a sleeping baby on their stomach or their side. They should always be placed on their back. Breastfeeding is always a good idea in infants, and here is a good case because it has shown to reduce SIDS. Make sure that the bedding fits well. Make sure there are no extra blankets. The blankets aren't loose. Make sure that there are no pillows or stuffed animals in there that can ultimately block the child's airway. Don't let the infant get overheated. Don't put them in too much clothing or cover them up, and make sure that the room is at a good temperature. Try to get the child to sleep with a pacifier. This just helps stimulate their mouth through the night and can keep them more alert during the night. And lastly, the child should sleep alone in their crib. You should not have your child sleep with you, but it is always a good idea to monitor them through the night to make sure that they are okay. Here's my citation page, and in closing, SIDS is a devastating syndrome because it can just happen so quickly, and a lot of the times parents are left with so many questions as to why it happened, and they don't usually get an answer for that. So I just strongly suggest that new parents look at SIDS and understand how it happens and ways that they can prevent it from happening, and that way this syndrome doesn't strike one of their children. Thank you.